Hey everyone, my name is Dr. Bruce Steinberg, and today I'm going to be presenting on autism spectrum disorders, the next logical step for the chiropractor. First, put your hands together for all the presenters for this weekend's conference. Absolutely amazing chiropractors and even more amazing content. So it's an honor and a privilege to be speaking on behalf of the first International Virtual Congress of Chiropractic. So, a little about myself. My name is Dr. Bruce Steinberg, and I'm a pediatric and family chiropractor located in the United States, specifically in upstate New York. One of my passions is speaking. Love speaking with the community, love speaking with the chiropractic community, and just basically anybody that will sit down for listen to what I have to say. One of my main objectives is to put the neuro, as in the neurology neuro, back into chiropractic. I love chiropractic. I love how it's a philosophy, science, and art. It's a philosophy that makes us different than anything else out there. But to be honest, the thing that really turns me on is the science. I truly believe it's going to be the science that saves the day for our profession. One of the things about me is I am what I like to call a self-proclaimed research junkie, otherwise known as a chiro nerd, N-U-R-D. Love the neurology, and I love how the nervous system is the huge thing that we have to delineate ourselves from all other things out there. And it's going to be the science that really sets the tone for the future of our profession. So today's presentation, we're going to start off talking about specific strategies when it comes to autism spectrum disorders. I think the logical thing to do is to go back in time, okay? Now, one of the things that happened to me about 10 years ago or so was I had a little girl come into the office, and what made this situation unique was she had autism, okay? Now, when the mom came in, she asked me, "Can you help my daughter?" And I said, "Yes." Now, I have to be honest. At that time, I wasn't really familiar with what autism was, and I didn't really know how to approach somebody with autism. But the reason I said yes is because as a chiropractor, there's one thing I know for 100% certainty, and that's how to locate, analyze, and correct of a vertebral subluxation. This form right here is known as the ATEC, otherwise known as the Autism Treatment and Evaluation Checklist. As you can see, it has 4 categories: speech, language, communication, sociability, sensory cognition, and also health and physical behavior. Now, the reason this form is so important is because this is a form that's universally used when they're trying to evaluate a child or adult with autism, okay? Now, one of the things that's really interesting is it came out in the mid-90s. It has 77 questions. And one of the things that I think is so valuable is it allows us as chiropractors to learn more about the patient in front of us, to learn more about where they are in terms of brain development and where they are in terms of what tools do they have to process their world, okay? When it comes to taking care of these individuals, one of the important things is, what does spectrum mean? Spectrum means degrees of. And just like autism spectrum disorder, there's different degrees of preparation. You have to look at, what does your office look like? What does the chiropractic skill set look like? Okay. One of the other things that there's degrees of is care plans. Some individuals, because it's a spectrum, they have really mild autism, and others have really severe autism, okay? So not everybody has the same exact needs. They're all unique and different. These individuals, it can be challenging to work with them, especially the ones that are nonverbal or the ones that don't make any eye contact, okay? So there are some unique challenges when working with these individuals. And there's also different degrees of outcomes. What is the thing that the parent is looking for if there's a child coming in with autism? If you promise the parent that with chiropractic care that the kid's going to start talking again or the kid's going to stop stimming, I think it's very important to be really reasonable when it comes to specific outcomes. Just like anybody else coming into the office. For example, if you had someone that came in with migraines, if you told the patient, "Hey, I'm going to help you with your migraines," and you found out that during the day 1 evaluation that this person didn't just have migraines, but also had digestive issues, respiratory issues, even low energy. And as you go through care, if you start to notice that, hey, the respiratory issues are resolving, the digestive issues are resolving, and they even have more energy, that's great. That's success. However, if they continue to have migraines and that is the clinical outcome that you're looking to resolve, then you actually failed that patient. So I think it's very important as chiropractors that we actually set very, very reasonable outcomes when it comes to symptom resolution. Okay. This is very important because I think this is one of the biggest sore spots in our profession. We don't practice medicine. We don't treat symptoms and disease. However, symptoms and disease are the language of the general public. They speak symptoms. And it's okay to talk about symptoms. But just remember, set the tone when it comes to setting realistic expectations with these individuals. What we do as chiropractors, it's conservative healthcare, okay? So one of the most important things, in my opinion, is you need to know your target market. In other words, you need to know where they are in order to get them. If these individuals are going to be the people that you really want to work with, you need to know a few things about them. You need to know what their lives look like, where they shop, where they hang out. This is what's called the target market. You need to be able to identify this target market and learn everything you can about them, okay? Now, one of the most important things that we need to do as a profession is we need to put out a very clear and consistent message. In other words, you need to know who you are as a chiropractor and what you specifically stand for, okay? So as an example of this, if you're the type of chiropractor that wants to see more children or even wants to see more children with autism as an example, but yet all your advertising is talking about musculoskeletal conditions like headaches and backaches and sciatica and headaches, well, guess what? You're putting a inconsistent message out there. Aside from advertising, what about in the office? What do your office decorations look like? Are they empowering? Are they of children? Are they talking to the moms themselves? So everybody has a different target market in their practice, and everybody has a unique skill set. But who is it specifically that you are trying to reach out to? And be careful when it comes to blurring the lines. You want a nice, clear, and consistent message, okay? So the goal is very simple. You want to become your community's most trusted healthcare advisor, because when you are trusted, they're going to come to you. And what's really neat is when they come to you, even without direct advertising. As chiropractors, we really like when people pay, stay, and refer. Chiropractic can give you a really nice lifestyle and can really make you feel like full of purpose, but I believe it requires you to become your community's most trusted healthcare advisor. So let's say the phone rings, okay, and you get that phone call. The parent wants to know, can you help my kid with autism? Okay, one of the most important things right off the bat is we need to make sure that the parent understands that the goal isn't to change the child. We're not trying to treat their autism. We're not trying to change the child's strengths. What we're trying to do is to get the child to be able to contribute at a high level within our culture. In other words, they already are beautiful. They already have all these gifts. What we want to do is basically, in essence, unlock their superpowers. We want to increase their state of well-being and to help the expression of their innate life potential. So technically, it's the same goal for everybody else that walks through your door, to increase their state of well-being and unlock their expression of life potential. Okay, I think it's very clear, it's very beautiful, and more importantly, what it does is it allows us to help the individual adapt to their everyday life, okay? So one of the most important things when we're talking to these parents is to stay in our lane, to have a really clear, consistent message, because the truth is simple. Do we treat autism as a profession? No, okay? However, do these individuals have a nervous system? Yes. Should they be checked for vertebral subluxation then? Yes. So that's why it's very easy to have a clear, consistent message when it comes to this. So when they call in and we ask them, has your child ever been under chiropractic care? Or has your child ever had their spine checked for vertebral subluxation? If the answer is no, that's great. What that means is we have something we can do to help these people, okay? So next we need to talk about logistics, okay? So one of the most important things that a person can do is do what's called the SWOT analysis, okay? You need to really look at your office in terms of systems, okay? Just like any other organization or organ system out there, there are systems in place. Systems make things organized. So it all begins with that initial phone call, and then it goes through all those processes. So one of the most important things to realize about this is your office staff is usually the first point of contact with these individuals, okay? So what that means is your chiropractic assistants, are they properly trained, okay? You as the chiropractor, are you properly trained, all right? That's very important. Because as the chiropractor, we need to have really great communication skills. We need to be able to build rapport with these individuals, okay? We want relationships with them, okay? One of the most important things to talk about, especially like say at the report of findings is, yes, we may have these moms on board, but what about the other parent? Sometimes we run into situations where one parent is on board, but the other parent is not. That's very, very important. Another thing to keep in consideration is a lot of these moms that come in, these lifestyles are very stressful. So what that basically means is moms are typically dysregulated. Moms are stressed. It's moms who actually need to care themselves as well. So I think what's very, very important is to have not just the child under care, but to have the mother under care as well, okay? So that's the communication. Next is clinical. In other words, do you feel confident that you can check this individual's spine properly? Can you deliver the goods, in other words? Super important as a chiropractor. And if you don't have the communication skills or the clinical skills, well, guess what? It's time to go out and search out those organizations or those people to assist you to get those. And then lastly, what I also think is very important is, what about you yourself? Is your system regulated? Okay, you can't be the most subluxated person in your own practice. So in other words, you need to be well adjusted. This is where the concept of interoception comes in. I think is crucial as a chiropractor if you're going to be taking care of individuals who have neurodevelopmental issues, individuals with autism spectrum disorders, that you yourself need to understand your own neurology in order to help these individuals. I know it's kind of a next level kind of concept, but it really is that important, okay? So let's talk about the science of autism spectrum disorders, okay? So the question is, well, here we are, it's the year 2020. The question is, how are we doing so far? Well, the answer, not so good. There's so much science out there, and yet, what do we know? We know we're in big trouble. So let's look at this right here. So this came out of a paper back in 2019, last year, and here's what it said. We can coax a body's own immune system to attack a tumor, eradicate viral and bacterial infections, fix heart defects, identify and correct for genetic disorders, and overcome the most debilitating injuries. We can also extend the lifespan and save infants born at 22 weeks of gestation, preemies in other words. However, when it comes to understanding and treating emotional and behavioral disorders that arise in infancy and early childhood, science has made relatively little progress since Darwin. Despite exponential increases in research over the last 40 years, there is little evidence that science is any closer to fully understanding autism, let alone curing it. The same can be said about ADHD, school-age child developmental issues, PTSD, and a host of other psychiatric and neurodegenerative disorders, where signs of success in the treatment and prevention of emotional and behavioral disorders have appeared. The lack of scientific theories that can explain their efficacy have hampered efforts to change standard medical care. All in all, emotional and behavioral disorders in infants and young children continue to be daunting challenges to science and among the greatest burdens to modern society. I'll read that last part again. Among the greatest burdens to modern society. So what do? I believe what we need to do is we need to change our focus. The focus should be on the mom. These mothers, they are riddled with guilt, they're stressed, they felt betrayed by the system that we relied upon, this quote unquote healthcare system. They're so confused. They feel like they have no support. You see, our focus has been on treating symptoms, to treat disease, to treat this thing. But in reality, the focus is wrong. In my opinion, the focus should be on the parent, the mother, okay? You see, the secret is these moms, they need care too. Moms are stressed. Imagine what happens if we take these mothers who are the advocates of these children, and what we do is we get these stressed mommies under chiropractic care. Can you imagine that? Can you imagine if we can get women who are pregnant under chiropractic care, or even bigger and better, get women under care before they even get pregnant, and they can have optimal vagus nerve firing, optimal autonomic nervous system function. This is a big deal, okay? And I'm going to show you why that is. Because when we look at the world of neurodevelopmental issues, we need to remember autism spectrum disorders is a neurodevelopmental issue. And there's some things that we know about the world of neurodevelopmental issues. For example, we know that the brain is the key focus. We know that the brain works with the gut. Brain, gut, brain, gut. We see that connection over and over and over. But the challenge is this. The minute we see brain, gut, we need to also talk about the immune system, because we know that the gut tissue and the brain tissue is primarily immune system tissue. So right off the bat, we have this triangle between the brain, the nervous system, the gut, and the immune system. Neuro, gut, immune, okay? We know that the immune system plays a vital role in this world. We know that when there's behaviors, which we're going to get more into in this presentation, that the immune system is highly involved. So when we look at this triangle, this is the triangle that's responsible for alterations in behavior and alterations in social interaction, okay? Now, one of the things that's very important when we're talking about this is we need to talk about these things called cytokines. We need to talk about inflammation, and we're going to be talking more about that in a moment. But what I want to do is to talk about the science of autism, because one of the most important aspects, in my opinion, is we need to be talking more about the autonomic nervous system, because to me, the future of the profession, if we're truly to survive and thrive, the focus should be on the ANS, the autonomic nervous system, okay? It's what's responsible for all of our organs. It's what's responsible for us thriving as an animal, okay, as a mammal. We need to be talking about, hey, you know what? Autism, without a doubt, involves the autonomic nervous system, okay? It's what connects the brain, the higher part of the brain, the part of cognition and behavior, to the body, as you'll see here shortly, okay? This means that when an individual, whether it's a child or adult, has decreased function within the autonomic nervous system, they have a decreased resiliency to stress. This is a big, big, big deal, okay? Because as we know, when there's life, there is stress. And when we adapt to stress, everything is great. However, one of the biggest challenges is when that stressor comes in and it affects our limbic system. When the limbic system is triggered, this alters autonomic tone, right? So when a person gets stressed, let's say there's a car suddenly coming at you while you're driving your vehicle, there's an increase in blood pressure, there's an increase in respiration, suddenly there's blood to the muscles so we can react. There's a change in digestive function, right? So we know that stress affects the autonomic nervous system. One of the things that's really neat is science is showing us this concept over and over and over in all of these papers. This concept of what's referred to as limbic lock and load. We know that there's this huge connection between the brain and the gut, between something called, well, the vagus nerve, which we'll talk more about because we have a profound impact on this system as chiropractors. Because when the stresses come in, and we know about the 3 T's, the thoughts, the traumas, the toxins, but we need to remember that there's actually a 4th T, which is technology. So as the stress comes in, there's a stress response that occurs in the body. And research is showing that this stress response alters gut function. And the altered gut function leads to inflammation. This leads to the pro-inflammatory cytokines, the POCs, as you see on this page. That's why some individuals, especially even babies, they have what's called leaky gut, where the gut junctions become weak and what's called leaky. But what's interesting is when you have a leaky gut, we're starting to see evidence of what's called a leaky brain. Yes, there's a connection between the brain and the gut. And when you knock out one, you knock out the other. And when this occurs, you enter a chronic inflammatory state. That's a huge deal, because what this means is at that point, you in essence have an individual that is no longer able to properly adapt to their environment. So if we look at this from the perspective of prenatal stress, while baby's going through development, what we have found out is that when a mom is pregnant and a stressor comes in, that can disrupt the maternal HPA axis, the actual stress axis. So what's important, and this is a golden nugget, when mommy is stressed, so is baby. Stressed moms create stressed babies. Or another way of thinking about it is sick moms create stressed babies. And when this happens, this alters the pathway development in these infants. And what's really important is to realize that when you alter these pathways, that can affect growth, that can affect organ function, that can affect mental health, and more importantly, that can make changes in that baby that last for an entire lifetime. You see, the reason is this. There are critical periods of development. There's these windows, you can think of them as, and here are 4 of those points of perspective. You have pregnancy, you have the infant years, you have childhood years, and then of course you have the adult years. What's really important is this. When these critical periods are altered, there's signs. So during pregnancy, there might be signs such as a small placenta, or there could be signs such as decreased baby movements. In the infant years, the signs could be things such as hypotonia, which is a huge deal when these kids do not have enough tone, right? When these kids have, say, a head leg after 6 months, that's a big deal. During childhood, these critical periods may be evidenced by things such as ADHD, learning disorders, or the thing that we're talking about here today, which is autism. And in the adult years, these could look like things such as anxiety or even executive function, okay? Things like mental health issues. What we're finding is that when the baby's development is altered, that can actually lead to very specific neuropsychiatric disorders. That's a big deal. So if we back things up and say, okay, let's focus on the children, we can actually kind of go back. We can go all the way back to preconception, because we know that there's a number of factors during the preconception years. The big one being maternal stress, mommy's being under stress, okay? Then you have the fetal years, which we'll talk more about, because that one is a big point of research in the last decade, especially when looking at things such as nutrition, looking at things such as mommy's being under stress. And then you have the infant years and the childhood years. But what's interesting is this. During these windows, they all affect the autonomic nervous system development. Because yes, as you know, when a baby's born, it's not fully developed. The brain is not fully developed. The immune system is not fully developed. But what we know is that during these critical windows of autonomic nervous system development, that can affect how the limbic system, which is responsible for the emotional processing, that we encounter as individuals comes together, it can develop plasticity that may be incorrect. Okay? What the research is finding is because of the limbic connection, this is what's responsible for all of these neuropsychiatric disorders that we're seeing in our children. Yes, there is a connection between the autonomic nervous system and also psychiatric disorders. There's always been a connection. We've known this as a profession for many years because one of the things that's very important to realize is, you know what? We used to have these chiropractic mental health hospitals. And I know that's not the topic of today's presentation, but even a century ago, 100 years ago, we started to see these mental health hospitals pop up. We knew as a profession there was a unique connection between the nervous system and things such as mental health. So one of the challenges is this. It's almost like babies are not born with a blank slate. It's almost as if they have an issue where they're kind of playing from behind. It's almost like they're starting in the negative, okay? When we know that there's specific prenatal stressors that can alter fetal development or even the expression of genes, what we know as epigenetics, things such as malnutrition, things such as hypoxia, preeclampsia, or even fetal cortisol, it's almost like these babies don't even have a chance by the time they're born. They're already playing from behind. It's kind of sad, but it's true, okay? These prenatal stressors, what we're finding is that even if a baby's born and it looks healthy, has a normal APGAR score, what we're finding in these babies, they actually have altered fetal programming. In other words, sometimes these babies have zero issues when they're born on the outside, but as they go through life, we see evidence of this altered development. So let's look at some of these prenatal stressors. One of the big ones is maternal malnutrition. Maternal malnutrition can affect fetal programming. So if mom doesn't have proper nutrition, that can lead to the baby, the fetus, not adapting properly, which can reprogram the hormonal system, the immune system. And one of the most common things that we see as an expression of this is intrauterine growth restriction. In other words, the babies don't have enough room to grow, okay? What we're seeing this expressed as in adulthood is increased risk of metabolic and cardiovascular disease, okay? That's malnutrition. Another big one is inflammation, when mommies are inflamed. There's a lot of evidence that's starting to come out to show that when moms are inflamed, this impairs neurodevelopment. And one of the main reasons is this. When moms are inflamed, it alters their immune system balance. One of the biggest reasons behind this is because inflammation changes cytokine expression. It changes cytokines, which are inflammatory immune markers or chemicals, okay? These cytokines literally change the fetal programming. One of the reasons behind this is because everything is connected. You can't just talk about the nervous system. You have to also talk about the immune system. When you're talking about the immune system, you're also talking about hormones. So when these mommies are stressed, they're producing too much cortisol. This increased maternal cortisol leads to increased CRH in the placenta, the glucocorticoids, the stress hormones. When there's more stress hormones in mommy's body, what we're finding is this actually stresses the placenta. The minute you stress the placenta, you are also stressing the fetal brain. That's a big, big deal, okay? So one of the concepts that's really valuable to know is that when moms are stressed, babies become stressed. And the question is, what exactly is the connection? What exactly is the conduit? And the conduit is actually really crystal clear in the research. It's the placenta. The placenta is the connection. The placenta is that connection between baby and mommy. The placenta is affected by mom's diet. It's affected by the environmental stresses, okay? It's affected by blood flow. It's affected between the transfer between mommy and baby. And it even affects things such as epigenetics. Okay, it affects the actual genes. So when we look at the placenta, or something we could talk about called neuroplacentology, it's what basically links the placenta to brain development. What we know is this: we know that the placenta is responsible for protecting the fetus. It's responsible for growth and development of that fetus, especially the fetus's brain. Okay, the placenta actually monitors the maternal well-being. Yeah, the placenta keeps track of how mommy's doing. It's so fascinating. It's that conduit between this miracle inside the mom and the mom itself. Isn't that amazing? Okay, it's responsible for the passing of the cytokines, the antibodies, the food, the hormones, the growth factors. It's kind of like the bodyguard. It's so neat. But one of the things that's important to keep track of is that when this placenta, because we know it's really important, when this placenta dysfunctions, it causes a dysfunction in the brain development of that fetus. So the take-home point is simple. Altered placental function leads to altered fetal brain development, and altered fetal brain development can lead to lifelong neurological impairments. And yes, that is the autism spectrum that we're talking about, these disorders. Okay, the placenta is a regulator. It's such a big deal. It's something that we need to be looking at more in the science world, the research world, and I'm going to make the case that we need to be looking at it even more in the chiropractic world. You know, it's affected by so many different things. It's affected by genetics, and it's affected by especially epigenetics, right? Because we know that these genes can be turned on or off like a light bulb. But what's important when we're looking at this, because I don't want to get too much into the placental triggers themselves, is that when we're looking at the big picture, is that inflammation is the key. Inflammation in utero, or another way of thinking about this is placenta on fire. Okay, I like to call this the phoenix babies. You know, the phoenix, right? The bird that's on fire. You know, that's how I look at these children. That's how I look at when this placenta is full of inflammation, which can happen from things such as preeclampsia, right? Because when there's preeclampsia, there's more inflammation in not just mom, but baby as well. And which is fascinating because there's actually research to show that when a birth, that there's preeclampsia, that there's an increased tendency to have a child born with autism, especially in males. Yeah. So when we have inflammation in the placenta, once again, that leads to altered function later on in life. So this amazing conduit, you can see it right here. You know, what's interesting is you can see between the fetus and the mom that there's actually a barrier there. These things actually don't touch. That the actual conduit between the mom and the baby is actually the immune system. The immune system is controlled by the nervous system. It's a conduit, okay? That's why we need to look at how the actual developmental side of the equation works. What we could call developmental windows, or easier, we could just call these critical periods. So in the embryonic period, which is the first 8 weeks after conception, they don't really know a whole lot how this works. We do know, though, that nutrients, or mommy's nutrition, plays a big role in the placental function. When we fast forward a tad bit to the actual fetal period, we do know that the placental blood flow is the connection between mom and baby. This is the connection between the mommy environment, the maternal environment, and also the fetal environment. So as it feels like I'm saying over and over during this presentation, the nervous system can literally be programmed for conditions that may not occur right then and there, but actually occur later in life. This means that brain development can be altered due to changes in the placenta. Huge, huge, huge. So what exactly disrupts the placenta? One of the number one things that we've discovered disrupts the placenta is actually preterm birth. There's a correlation. There's a lot of children now that are being born before their due date. So what that means is these children that are born before their due date, that they're spending life, which would be in the womb, instead outside of the womb, which we could just consider an external utero environment. Okay? When this happens, when the baby's born before they're supposed to and spend time in the outside world, that alone is a disruptor. It's a stressor that research shows, as you can see in this research paper from 2019, that this disruption leads to altered fetal postnatal development. Okay, there's a reason that the baby's supposed to stay in for a specific period of time, which is the 40 weeks. This is why I like to call these children, it's almost like they're undercooked. Okay, so preterm is anything that is less than 37 weeks. What's interesting is this: when these babies are born preterm, they spend life outside the uterus in that third trimester in the outside world. But what we know is that these children have a tendency to have lower vagal tone. Isn't that fascinating? So when they're born early, that the nervous system is affected in a negative way, and the negative way is an expression of vagal tone. One of the reasons behind this decreased vagal tone is that these children typically have an underdeveloped nucleus ambiguus. Okay, that is a pathway for the vagus nerve. This explains why they have altered autonomic nervous system function. And if you have altered autonomics, you have altered health. It's that simple. These children that are born full term, they have that vagal brake intact. They typically have the higher HRV as a result, because as many of you know, you can look at heart rate variability as an index into the autonomic nervous system, right? That is a marker for maturation of the vagus nerve. So let's look at this vagus nerve. Let's look at this autonomic index. So we have the sympathetic nervous system and we have the parasympathetic nervous system. But the parasympathetics, let's break it down a tad bit. Let's look at it from a ventral vagus perspective and a dorsal. Because as you can see in this diagram, the ventral nervous system is above the diaphragm and the dorsal vagus system is below the diaphragm. Pretty neat the way it's broken down like that, okay? So this is a recent paper, and what it looked at is how the autonomic nervous system plays a role with neuropsychiatric disorders. So as a chiropractor, you should be getting really excited looking at something like this, because when you look at that diagram, you see the brainstem, you see the nuclei of the autonomics, okay? So you can see how the parasympathetic system is connected to the dorsal motor nucleus of the vagus and also the nucleus ambiguus, okay? This is a big, big, big deal, because when we deliver chiropractic care to people, when it's necessary, we have a direct impact on those nuclei. You can see how in blue, the nucleus tractus solitarius, that is a sensory part of the vagus. We know that the cervical region, the neck, fires directly into the NTS. This should excite you. This means when a person has an upper cervical subluxation, that ties right into this system. This explains why sometimes people, they have a change in their emotions, that they can learn easier, or they're just plain old healthier when they get adjusted. I don't know about you, but you should be really, really excited about this, because I'm super excited about this. So if we actually look at the nucleus ambiguus a little closer, it's fascinating, okay? It's also known as the ventral vagus, okay? They call it the newest gear, because this is the newest part of the nervous system to be evident, okay? So during the prenatal time, that's when it develops, okay? It develops during the third trimester, okay? When the baby's born, when it's born at term, this is connected to the brainstem reflexes, okay? The brainstem reflexes that are necessary for survival, the suck reflex, the swallow reflex, the breathing reflex, okay? What we know is that this connects to vital processes. A little bit later on, as you can see at 6 months, these brainstem reflexes are controlled higher by higher processes, the cortical system, okay? It's the whole upstream versus downstream, because we know that the baby's nervous system, the baby's brain develops from the bottom up, back to front, and then front to back control, right? We know that that final pathway is that frontal lobe. That frontal lobe is a big deal when it comes to soothing the system, okay? So the question is, where does this come from? And I think the take-home message that we should be not just knowing as chiropractors, but owning as chiropractors is right here. That inflammation plays a huge role in not just overall health, but it actually plays a huge role in altered brain development. And this altered brain development can look like things such as motor changes, look like cognition changes. It also changes in behavior. Now, what do these things look like then? Well, those things are what we call autism. Okay, those are signs of autism. So we need to look at these maternal insults. Okay, we need to look at what is mommy's life like. We need to get these moms under proper chiropractic care, because we now know that when the nervous system is altered in utero, it alters the expression of life for that child. Maybe not then and there, but way down the road. Okay, this causes these children to have an increased susceptibility to neurodevelopmental disorders. Huge, huge, huge. So, as chiropractors, you may know of one cause, one cure. Dr. Fred Barge, he said, there is but one cause in disease, the body's inability to comprehend itself and or its environment. There is but one cure in disease, the body's ability to heal itself. And there is only one thing that any doctor can do for a patient, and that is to remove an obstruction to healing, thus facilitating it. So, no, this does not mean that the cause of all disease is a subluxation and the cure for all disease is the adjustment. It's about the individual being able to adapt to their internal and external environment. When a person has their spine checked for vertebral subluxation, and we go in and we locate that subluxation and we analyze it, and even more importantly, correct that subluxation by the adjustment, we allow that person's innate intelligence to be expressed at a higher level. We arouse innate. We allow that person to function at a higher level. And you know what's really neat about this? We can look at this from a scientific perspective. I am certified by the ICPA in pediatric care, and Dr. Jeannie Yom, God rest her soul, she was a huge advocate for care during the pregnancy years. And I remember sitting in Dr. Jeannie's class, and she talked about the 3 Ps, the power, the passage, and the passenger. The power being those nerves between mom's body to the baby. The passage being the nerves that control the biomechanics of the pelvis, right? The room for the baby. And then lastly, the baby itself. We know that when these moms are under chiropractic care, it is beneficial not just for the mom, but also beneficial for the baby itself. At this point, we have tons of science, but the truth is we need even more. Those case studies, even though they're N of ones, they are very, very, very important. They show the world what we have to offer. So where are we going with this? What does the future look like? I think this right here speaks volume. This review of research shows a relationship between chiropractic care and positive health outcomes in children with autism. So you know what this means? Simplistically, we as chiropractors can help these people. We can help these children. And I think it's very important for you to have absolutely no doubt in your mind, to have full of certainty that you know that you can help these people. Okay? But please understand that we need to approach this not from a medical perspective, meaning we're not going to treat these symptoms of autism or treat the diagnosis of autism. What we rather need to do is to look at it from a salutogenic perspective. We need to look at it from a preconceptive care model, okay? We need to start these women under care before they even get pregnant. In other words, the goal should be to get these women as healthy as possible, because the healthier the woman, the healthier the pregnancy, okay? And if you can't get to them before they're pregnant, you have to get them in when they're pregnant as early as possible, right? You want to start them during the first trimester. And then the next logical step would be, once that baby's born, to have that baby checked, okay? Especially the upper cervical area. The upper cervical area has a huge connection directly into the autonomic nervous system. So one of the other things is, what about the prenatal period? The prenatal period is absolutely crucial, okay? This is where we get to talk about the mom, okay? Yes, the focus of this presentation, as you figured out, it's been the mom. And we need to reduce the allostatic load. We need to remove and reduce the stresses as much as we can, okay? As much as you're comfortable doing as a chiropractor, meaning we need to teach them about movement, because when you don't move, you get inflamed. We need to talk about proper nutrition. We need to talk about reducing overall stresses, and there's a lot of them in today's culture. Just being alive during the COVID-19 year here, this alone is a very stressful time, okay? This affects the psychology of the moms, okay? Also, after the baby's born, we need to shift the focus on not just the mom, but also the baby as well. Both. We need both regulated, okay? This is where breastfeeding comes in. Breastfeeding helps the baby because it gives them custom-made food and nutrition, but it actually helps the mom as well. So we're actually affecting the nervous system of both mom and baby. Skin-to-skin contact. We know that both of these result in an increase in oxytocin. We know that it increases the vagus nerve. This is huge. The vagus nerve is that conduit, right? Maternal singing. The singing, that is stimulatory for the vagus nerve for both mom and baby. Isn't that something? That connection, the connection exists, okay? That's why this needs to happen, especially during these critical periods. So there's some things we really need to keep in consideration. It's never too late to start care, but the earlier you start care, the better, okay? Maybe you should have a rule in your office where you're not going to start a child under care unless the mother's under care as well. That the parent needs to be willing to reduce the stresses, the allostatic load on this baby. Sometimes the grandparents actually play a role. We need to make sure that the extended family members are on board and supporting the healing for this kid. Or, especially here in America, we have a lot of single parent homes or divorces. And because of that, we need to make sure that both parents are on board of this. We need to almost approach it like an all or nothing kind of situation. So I do a lot of studying outside of chiropractic, and I like this book a lot right here called The Neuroscience of Psychotherapy by psychotherapist Louis Cozolino. And he had this to say: if everything we experience is represented by instantiations within neural networks, then by definition, psychopathology of all kinds, from the mildest symptoms to the most severe psychosis, must also be represented within and among neural networks. In line with this theory, psychopathology would be a reflection of suboptimal development, integration, and coordination of neural networks. He's basically saying that when a person has a psychiatric disorder, that what that psychiatric disorder actually is a reflection of suboptimal development, integration, and coordination of the nervous system. What does that sound like to you? It sounds like a subluxated person. So what I say is this: what if a person, a child with autism spectrum disorder, what if the autism actually is the same exact thing? It's a reflection of suboptimal development, integration, and coordination of neural networks. So I hope this presentation helps you. I hope it helps you get that certainty, to get that crystal clear mentality that yes, we can help these individuals, but the truth is it takes a village. It takes people of all different backgrounds to come together to support this individual, to support these children. But the biggest thing to take away is this: as chiropractors, we not just belong at that table, we may hold the most critical piece of that puzzle. Get better at the science, get better at communicating, and get better at delivering the clinical goods. Your community is waiting for you. I hope you found this information valuable. I hope that this information makes you want to dig in. I hope it makes you crave to learn even more about how to help these individuals with autism spectrum disorders, because this is a problem that's not going away anytime soon, and it's a problem that's going to get bigger and bigger and bigger. So please know that you are enough, that you have the tools that you need to help these people. All it takes is a desire to serve at a higher level, a desire to learn more, not necessarily to do more, but a desire to help understand the struggle these individuals have, and more importantly, how to help them truly live a more abundant life and have a higher expression of their innate potential. Just like you, I can help change the world with my own two hands. My name is Dr. Bruce Steinberg. I hope you have a wonderful rest of your time during this conference. God bless.